Morning. Myself, Dr. S. Mohammed Akram Ali, PharmD, Assistant Professor, Department of Pharmacy Practice, Shishanwar College of Pharmacy. Uh, as we discussed before, the myocardial infarction, then its types, signs and symptoms, etiology, diagnosis, and pathophysiology. So today we're going to see the treatment for myocardial infarction. Before getting to the topic, first we can see the overview of myocardial infarction. Myocardial infarction is nothing but a heart attack, which blood, which blockage of the blood supply to the heart that leads to myocardial infarction. So myocardial infarction is nothing but the blood supply of the heart is blocked, that leads to a severe pain called a heart attack. So that condition is called as a myocardial infarction. So its treatment was divided into two types. One was pharmacological treatment, and another one was a non-pharmacological treatment. Pharmacological treatment means with drugs, and non-pharmacological treatment means without drugs. So here the first line drug for myocardial infarction is nitroglycerin. The drugs called isosorbate dinitrate and mononitrates. The dose for sublingual tablet. Sublingual tablet is nothing but the tablet which is taken by placing under the tongue. So its dose was 0.4 mg repeated every 5 minutes up to 3 doses. Then in IV infusion, the dose was 5 to 10 mcg per minute. Its mechanism of action was dilates blood vessels by increasing the production of nitric oxide and improving blood flow to the heart. So as we know that myocardial infarction is due to the blockage of blood flow. Here this drug increases or improving the blood flow to the heart. So that's why it can be preventable through this drug. Then its ADR was headache, hypotension, tachycardia, etc. Then second one was aspirin. Aspirin it comes under NSAIDs. The dose was 162 to 325 mg, chewed or swallowed once daily. So its mechanism of action was it inhibits platelet aggregation, reducing the risk of blood clots. So blood aggregation and blood clots can also lead to the blockage of the blood supply to the heart. So here this drug prevents the platelet aggregation and reduces the risk of blood clots. So it can be preventable through this. So its ADR was gastrointestinal bleeding, tinnitus, then allergic reactions. Then second one was aspirin. Aspirin it comes under NSAIDs. The dose was 162 to 325 mg, chewed or swallowed once daily. So its mechanism of action was it inhibits platelet aggregation, reducing the risk of blood clots. So platelet aggregation and blood clots can also lead to the blockage of the blood supply to the heart. So here this drug prevents the platelet aggregation and reduces the risk of blood clots. So it can be preventable through this. So its ADR was gastrointestinal bleeding, tinnitus, then allergic reactions. Then the third drug was heparin. It's an anticoagulant. So its dose was in IV bolus 60 to 70 units per kg, followed by a continuous infusion of 12 to 15 units per kg per hour. Then its mechanism was inhibit blood clot formation by preventing the conversion of fibrinogen to fibrin. So that's why its act. Then its ADR was bleeding, thrombocytopenia. Thrombocytopenia means decreased platelet count, so it's called as an thrombocytopenia. The next drug was beta blockers. So its drug was metoprolol, carvedilol, atenolol, propanolol, etc. So in this metoprolol dose was 25 to 50 mg orally every 6 hours, or 5 mg intravenously over 5 minutes. Then carvedilol 6.25 to 12.5 mg orally twice daily, and its mechanism of action was blocks the beta receptor in the heart and diminishes the heart rate, blood pressure, and myocardial oxygen demand. Then its ADR was bradycardia. Bradycardia means decreased heart rate, then hypotension, fatigue, then bronchospasm in patient with asthma or chronic obstructive pulmonary disease. Then next drug was ACE inhibitors. ACE means angiotensin converting enzyme. So angiotensin converting enzyme plays a crucial role in RAS system. RAS means renin angiotensin aldosterone system. So this ACE receptor converts the angiotensin 1 to 2 and increases your blood pressure. So here this drug blocks the receptor AC receptor. So drugs are involving in this class are linsinopryl and enalapril. So linsinopryl means that dose was 5 to 10 mg orally once daily, and enalapril 2.5 to 5 mg orally twice daily. So its mechanism of action, as I said, ACE means angiotensin converting enzyme. So here ACE inhibitors means that inhibits the angiotensin converting activity, which means as we said, ACE is reason for converting angiotensin 1 to 2 and leads to aldosterone and increase your heart rate. Here it blocks the ACE means it stops the conversion of angiotensin 1 from angiotensin 1 to angiotensin 2. So that's why its act. Then its ADR was hypotension, dry cough, and hyperkalemia. Hyperkalemia means increased potassium level. Then statins. Statins also the main drug for myocardial infarction. So the drugs are atorvastatin, simvastatin, rosuvastatin, etc. The dose of atorvastatin was 40 to 80 mg orally once daily, and simvastatin was 20 to 40 mg orally once daily. So it should be taken at evening, because the synthesis of cholesterol was occurred only during evening time. So this drug preferable only at evening time. Its mechanism of action was it acts by inhibiting the enzyme HMG-CoA, which means 3-hydroxy 3-methyl glutaryl coenzyme A. So by blocking this, it prevents the synthesis of cholesterol. So its ADR was myopathy, muscle pain, elevated liver enzymes, then gastrointestinal disturbance. So in this we have discussed the treatment of myocardial infarction. We've seen nitroglycerins first line drug, then aspirin, then AC inhibitors, beta blockers, then statins. So these are the drugs which prevents the myocardial infarction. So next topic we see later about the surgical procedures of myocardial infarction. So by now, thank you all.